Hi everyone, so this is lesson 2 of Skin Camouflage and this is all about how to carry out the consultation techniques, just some little tips, discussing some of the contraindications and contraindications that may need medical referring, carrying out the actual treatment itself, so some little tips on how to position the client, etc. and then how to provide effective aftercare advice as well. Okay, so first up we have got how to use effective consultation techniques. So with Skin Camouflage, obviously some of the clients may be really anxious, they may be nervous about getting their area or imperfection or disfigurement out for a makeup artist or Skin Camouflage practitioner. So obviously making sure that you use polite and friendly manner at all time is really important, and making sure you're making them feel comfortable and showing that you've got empathy. Okay, so trying to distinguish what their client needs are. Okay, so thinking about what the area is, what they want concealed, and making sure that you can fulfill their needs. Also, what you need to make sure you're doing is that you're completing all the paperwork. Okay, for this I'm going to do a separate little tutorial about the paperwork and how to fill it in, but we have a treatment plan, we have your normal assessment sheet as well. Okay, so we need to make sure those are completely filled in. The treatment plan has got all about the consultation process really, so it's anything that you've discussed or you're going to discuss with your client, so the benefits, contra-actions, anything that you can promote or any retail products, etc. Okay, so that's quite important that you fill that in. However, if the client is under the age of 16, then what you need to do is make sure you've got parental consent and a parental signature if the client is under 16, and the parent or guardian needs to be present when you're performing the treatment as well. So bear that in mind as well. What you need to make sure you're doing is you're clearly explaining what the treatment entails and the benefits. Okay, talk through the process, talk through the products you're going to use, and make sure the client is happy and that you've allowed them to ask any questions and that you've answered the questions to clarify any concerns or worries that the client may have. Another thing that you need to do is a skin analysis. As always, for any makeup it's exactly the same. So you're doing your manual and visual skin analysis. You're checking the area and assessing the area for the skin type, the tone, and you're also checking for any contraindications. Okay, so obviously some of the conditions that we're going to be working on, or some of the areas we'll be working on, could potentially result in a contraindication. So that's something I'll talk about in a moment. So we need to make sure we're assessing those. Okay, but the main point of our consultation process is that we clearly identify the client's needs, and we need to establish the area that needs to be camouflaged, and we need to make sure that the client's expectations are realistic and achievable. So what I want you to try and remember and make a note down is the expectation of the percentage that is going to be covered with this camouflage makeup. Okay, it was in the previous lesson that I did, so I want you to maybe look at that and just see if you can remember what the percentage is. When it comes to consultation questions, these are really important. They need to be quite probing questions, and you need to establish what your client actually wants, and you need to sort of really ask these questions to make sure that you're clarifying it and you're assessing the area being worked on as much as you can. So certain things, these are just examples, so obviously you need to make sure that you never assume why the client is coming in to see you. Okay, allow them to tell you what they want to have done and why. Okay, so one question to probe, you may have to ask which area they want correcting, okay, or what they want camouflaged. Okay, the next thing is maybe how long the imperfection has been there. If it's a scar, what caused the scar. Okay, so it could be a burn, it could be an injury, it could be post-operative. Okay, then that will sort of probe you on to ask other questions. So if it's post-operative, you might have to ask how long it's been healing, when did you have your surgery, you know, was it a medical condition that we need to be aware of that caused the operation, etc. You may also have to ask, particularly those that have had maybe tattoos and they've had removal, or they've got pigmentation disorders, they may opt for laser surgery. So you may have to check whether they're having or had laser surgery, because that could leave the area open to cross-infection, and it can be quite sensitive as well. So something to be aware of. And one of the most important questions to ask, because we're going to be working on areas as we spoke about in lesson 1. So you're going to be working on bruising, you're going to be working on different types of scarring. So what you do need to ask is there any soreness or lack of sensitivity in that particular area that you need to be aware of, so you know how you can actually apply the product and how gentle you need to be, and maybe what tools that you're going to use to sort of do that with. So always question the client to confirm understanding, and I cannot stress this enough, that never assume why they're coming in to have a treatment. Always allow the client to tell you and explain what areas need camouflaging, just to avoid any unnecessary embarrassment and making the client feel uncomfortable. When it comes to contraindications, so what I'd like you to do is research a little bit more and look at your essential knowledge disease and disorders assignment. Okay, this will help you remember some of the skin disorders or diseases that would prevent or restrict you from performing a cosmetic camouflage treatment. You really want to make sure that you understand and you know what to look out for when it comes to any contraindications that would prevent this from happening. So anything like broken skin or unhealed wounds, okay, so if they're open, if they're weeping, then you cannot work on those areas. Okay, obviously if someone has bacterial eye infections such as conjunctivitis, we need to avoid because they're highly contagious. If there's any skin swelling, irritation or particular soreness of the area that you have been asked to work on, I would always make sure that you be mindful of that. Okay, you're also going to be looking out for stuff like suspicious moles, which I'll talk about a little bit more in a little while. But if you're covering any post-operative bruising or scarring, then you must obtain the surgeon's permission, particularly if it's within sort of 6 weeks of them having it. Okay, I don't think that the surgeon would advise it at all. Okay, so that's something to be aware of as well. Certain things, as I said, need medical referral. So obviously your skin infections, anything that is infectious and there's a risk of cross-infection, those need to be referred and you wouldn't work on them because they would prevent anything going ahead. You're also looking at structural changes. So if it's a client you've worked on quite a lot, and they've noticed that there's been a change in the area that they're having camouflaged, they may experience pain or discomfort. So there may be an underlying medical condition that you're unaware of. So you don't want to aggravate it by working on that area. So you would have to make sure you refer that client on for medical advice. And as I said, suspicious moles as well. So a mole could be malignant. Once again, if that client is a regular client and you notice a change in their moles, or even if it's a new client and the mole looks a little bit suspicious, then I would definitely recommend that you refer them for medical advice. Never scare them. Don't say, I think that's cancerous. Just say, your mole has changed shape or the colour is a little bit different. Probably worth just getting that checked out by the GP. Okay, so don't scare them, just try and give some gentle advice. Okay, this is where you have to be a little bit more tactful, so one of those qualities that we were looking at before. Okay, what I'd like you to do is maybe research into the moles a little bit more. So maybe look at the key information that you'd need to be aware of for when you're doing when you're looking at moles and you're sort of maybe putting people through for medical referral. So that's a little bit of research you could do extra for this as well. Okay, when it comes to preparing the actual client, okay, we need to make sure that the client is happy, comfortable, relaxed as much as we can. So thinking of all those environmental conditions that we need to think about in the first place. And we talked about those in lesson 1. Okay, so you should have researched that by now. Then we need to make sure that the client is positioned really comfortably, either on a chair or couch. That will determine what they sit on, will determine what area they're being worked on, okay, which I'll talk about in a moment. So what you want to do is cover the client's clothing in any area to be treated, okay, so the surrounding area, make sure any clothing or anything has been protected. If you're working on the face, make sure there's a headband on, make sure there's a gown covering the client's clothing. And also remove any jewellery if necessary. When you're working on the client's face, you must have them sitting in an upright position, okay, so they need to be sitting up, mainly because you get to see the natural face shape, and you get to see its contours a little bit easier, so you get a more accurate and well applied makeup from that. You also need to make sure that they're in a sitting position or sitting up if you're working on the arms or shoulder area. However, if you're working on their stomach or abdomen or torso, whatever you want to call it, you need to make sure the client's laying down with maybe support under their knees and their head as well. When you're working on their back, they need to either be sitting up, okay, or laying on their stomach. When it comes to legs, they can either be lying on their back or front, depending on what part of the legs are being treated. And as always, once you've got them all comfortable in the right sitting position, you would need to cleanse the area. And I always would obviously do your skin analysis, use your cleanser, but then you need to use a toner around the area. You want to remove as much oil as possible. So I would always cleanse the area with maybe rose water. And that will make sure that the area is ready to be worked on. Okay, when it comes to treatment timings, there's no particular service time that has been explained for this unit, but if you're doing a makeup lesson for Camouflage, you can have up to an hour really, and that's kind of acceptable. If the area is fairly large, then you want an hour as well. If it's medium sized, you'll want to look at half an hour, and for a tattoo, really up to half an hour, depending on its size obviously. So you're looking between half an hour and 1 hour for your treatment timings, so that's something to be aware of. Your consultation is probably the thing that's going to take the most time up, okay, talking to the client, establishing the area, assessing the area, and the actual application isn't time consuming. It's more the probing, the questioning and the consultation techniques. Okay, so when you're doing your makeup application, you will obviously need to do skin colour match. So that's in my tutorial. There's loads of videos on Moodle as well to sort of help you with this. So within our Veil Cover Cream set, we have numerous amounts of concealer colours. Never go by the colour in the tub, okay, you need to make sure you're testing this on the actual area that you're working on. So around the area you need to make sure you're getting a skin colour match. Okay, but we do need to do a little bit of colour correction. Okay, so we've got obviously our key colour correctors which are in our kits. We have green, we have lilac, we have a white or cream as well. One other colour we have is a rose, which I'll talk about as well. But green obviously counteracts high colouring, sort of any redness. Lilac counteracts any sort of yellowness or sallow skin. Sometimes it can help disguise any sort of dark circles as well. White or cream colour correctors are good for unevenness, so in skin pigmentation it's really quite good. They're quite light reflecting, so they work really well. When it comes to rose, if you've got anything which is really dark, so anything which is on the sort of browny black sort of tones, rose can sometimes be a really good brightener for those particular areas, and it helps conceal those a lot better, and that is actually in one of my tutorials. However, when it comes to skin colour matching and colour correction, I like to mix a bit of my colour corrector with my actual skin tone I've mixed, so it's not so strong. What you'll notice about these colour correctors in Skin Camouflage is the pigment is really strong, and it can sometimes leave a little bit of a green or lilac sort of haze underneath your makeup, and it never sort of goes away. So you have to experiment, you have to practice to perfect the amount that you're using, and what you want to do is correct and not have any of these undertones of these colour correctors at all. Okay, so I hope that makes sense, but in my tutorial and in my explanation of prior to the actual makeup application, I do explain that a little bit more. Okay, when you're carrying out your skin camouflage treatment, it's really a good practice when you're doing your consultation technique to ask the client if they would give you permission to take a before and an after picture. So that's really quite important. Obviously, if they don't give you permission, you can't do that, but it's really good for the client and yourself to see the difference on how it looks and how well it's covered as well. Okay, then what you do is you collect you'd select your chosen colour or mixtures of colours for your skin tone. So I always do that first. That's the first thing I do. So whatever area you're working on, I check the skin colour match and mix my skin tone first. Then what I do is attempt the colour correction. Okay, that's probably my first bit that I would do. And then I would then put the colour over the top. To apply the product, you can either use applicators like your sponge or a brush, or you can use your fingers, or you can use all of them like I did in my little tutorial. Whatever you find conceals and works the best and gives you the most even finish. Always apply products according to the manufacturer's instructions. Okay, so it is quite important that you look at the Veil Cover Cream tutorials on YouTube as well, okay, which I have put into Moodle. Have a look at those, because that is how they advise you to actually apply the makeup. Once the required result has been achieved, check that the client is happy with that. Okay, and one thing, if you remember, there's one really important thing you need to establish in your consultation technique is whether there's going to be any photos being taken. Okay, so if there's flash photography, there's a particular ingredient in these products which could create a ghosting effect, so that's something I want you to remember and make a note of. Okay. And then once you're finished and you're happy with the result, apply the fixing powder for one last time. Make sure you put quite a bit on, let it settle in the skin for about 10 minutes, then brush the excess away. Okay, and then after that you can apply a fixing setting spray as well. Okay, if you're working on the face, some clients may require a makeup application afterwards, so they want a normal makeup put over the top of the Skin Camouflage. Once again, I've done a tutorial of this on myself, so that's something for you to look at. And then you always must record the products used on the client's record card. Okay, so put the area that you worked on, the colours that you've mixed together, any colour correction as well, and log the result of that. Okay, and then we're coming to the aftercare, so the last part of this lesson. Okay, so aftercare, you would need to make sure that you give an advice and recommendations accurately and constructively. Okay, so you need to know what the aftercare advice is obviously first, which I'm going to tell you. Giving advice specific to their individual needs, so you may need to give them some details of what they can buy, what products they can buy, what you've used, skincare, any other sort of treatments or services that you could maybe recommend that would help their condition. Okay, stuff like self-tan, etc. Then you need to give advice on any contra-actions that may occur. Even if these products are hypoallergenic, people can still have a reaction, okay? It doesn't mean they won't, okay? So you still need to give that information. You need to discuss with the client the best way for them to keep the makeup looking good and how it should be removed. If they have had a lesson and wish to apply the products at home, then they may need more specific advice. So this is the point where you may have to do some written instruction for your client, okay? So you might need to make even more of a record. You may need to use your face chart on your assessment sheet and make some detailed notes for them. But when it comes to actual aftercare advice that you need to provide, okay, so one of the things is talking about other products which can be used in conjunction with skin camouflage, okay? The next thing would be durability and removal of the camouflage products, so talking about that. And then most importantly, products or environments which should be avoided. Okay. So other products that can be used in conjunction with skin camouflage. So you can actually have, you can advise the client that they can have skin tanning products to help camouflage or make the condition less noticeable, particularly if it's like hypo or hyperpigmentation, okay? Some people may feel a little bit more comfortable with a bit of fake tan on, okay? So you can use camouflage makeup. It just means you'd have to adapt your skin colour match, okay? So every time we do a skin camouflage treatment, we always check that anyway. And then obviously you can use foundation, eyeshadow, blusher, lip colour, any makeup products that you may need to sort of work over the top. One element you need to make sure of is that they do not contain oil. Products and environments that you should be avoided. So I've just talked about this. So avoid any oil-based products as they will dissolve and remove the makeup. Avoid overexposure to UV light because this can aggravate any pigmentation disorders. So that's something that you may need to make sure that they are having full-on sun protection or just avoiding too much exposure to UV light. One really important one is avoiding heat treatments such as saunas, steam rooms, hot tubs, because although it's waterproof, it's not heat proof, okay? So certain temperatures, if they reach a certain point, they can dissolve the makeup and make it be removed. Then you've got durability and removal of skin camouflage products. So you can advise a client that this makeup will last between 8 to 12 hours. Okay, really 12 hours is what I would sort of kind of recommend. Advise your client to remove the skin camouflage makeup. It needs to be removed with an oil-based makeup remover. So they can use baby oil if they want, but I would advise something like Clear Cleanse or Veil Cover Cream or Veil Cover do their own skin range, which is oil based as well. The oil will just help break down and dissolve the makeup and makes it removed easier and quicker. And very often skin camouflage manufacturers recommend their own line of skincare, which I've just talked about. So it's worth doing a bit of research, which is in your assignment anyway, on the skincare prices and websites where you can actually purchase these products. Any retail opportunities, so if they wish to apply the products at home, they need to purchase all the products you've used. So make sure you make a log of them and that you've explained how they need to successfully apply and remove them. Okay, so that's quite important. So you might need to go over that again in the aftercare. You may also need to recommend suitable skincare products for home use to maintain a good skin condition. And camouflage makeup should never be left on longer than 24 hours, obviously. So always make sure that they are removing these products. Okay, so that leaves us on to lesson 3. I'm quite looking forward to this one. This one's all about colour correction in a little bit more depth. It's about UVA and UVB rays. It's about the Fitzpatrick classification system, which you might need to be aware of to help you determine what advice you give the client. And some more detailed techniques about particular conditions and complete different camouflaged range that you might need to use, and some of the colour correction needed for that. Okay, so I will look forward to hearing from you on lesson 3. Make as many notes as you can from this lesson, lesson 2. Have a look at some of the paperwork that you are going to need. I will do a tutorial just particularly on the paperwork and post that as well. Okay, many thanks, and once again, any questions, any queries, anything you're not quite sure of, write a comment or send an email. Many thanks.